Cervical spondylosis is an age-related medical condition that mainly affects the cervical spine, which is located in your neck. It is also known as cervical osteoarthritis and neck arthritis. The joints and discs of the cervical spine are the most affected. Cervical spondylosis develops as a result of wear and tear of the bones and cartilages. As you age, these areas decay naturally, causing pain. Long durations of sleeping or sitting in the wrong position can increase your risk of developing cervical spondylosis and make your symptoms worse. However, there are natural home treatment options that can help soothe the pain. To know how to combat cervical spondylosis, watch the video till end. While some individuals do not develop any symptoms, some may experience chronic pain that is accompanied by stiffness. Signs and symptoms of cervical spondylosis. Those affected by cervical spondylosis hardly develop any significant symptoms. But, when the symptoms do surface, the condition can be mild to severe, and its onset can be gradual or sudden. One of the most common symptoms of this condition is pain around the shoulder blades. Some have also encountered pain in their arms and fingers. This pain tends to increase when you are standing or sitting for too long, sneezing, coughing, tilting your neck backward. Other signs of cervical spondylosis may include stiffness of the neck, a headache, especially affecting the back of your head, tingling or numbness of your shoulders and arms that may also affect the legs at times. Natural home remedies to cure cervical spondylosis symptoms. Natural ways to manage cervical spondylosis. 1. Epsom salt baths. You will need 1 cup of Epsom salt water. What you have to do: add a cup of Epsom salt to your tub. Fill the tub with water and allow the salt to dissolve. Soak in the Epsom salt bath for 20 to 30 minutes. How often you should do this? Do this once daily or alternating days. Why this works: Epsom salt contains magnesium, which exhibits anti-inflammatory activities that can help with the pain and or inflammation of your cervical spine. 2. Hot and cold compresses. You will need a hot compress, a cold compress. What you have to do: apply a cold compress to the affected area for the first 24 to 48 hours. Place the ice pack on for at least a minute before taking it off. Repeat the procedure 3 to 4 times. After 48 hours, use a hot compress and repeat the procedure. How often you should do this? You may do this 2 to 3 times daily or whenever the pain strikes. Why this works: while a hot compress helps by increasing circulation and relieving pain and stiffness, a cold compress alleviates symptoms of inflammation and swelling and also numbs the affected area. 3. Garlic. You will need 2 to 3 peeled garlic cloves. What you have to do: chew on 2 to 3 peeled garlic cloves every morning. How often you should do this? Do this once daily for the desired results. Why this works: garlic has both anti-inflammatory and analgesic properties. It is a great remedy to alleviate pain, inflammation, and swelling of your cervical joints and discs. 4. Turmeric. You will need 1 teaspoon of turmeric powder, 1 glass of hot milk. What you have to do: add a teaspoon of turmeric powder to a glass of hot milk. Mix well and consume. How often you should do this? Drink this at least once daily, preferably before going to bed. Why this works: the curcumin in turmeric possesses anti-inflammatory and pain-relieving properties that can work wonders for cervical spondylosis. 5. Sesame oil. You will need 1 tablespoon of sesame oil, a hot compress. What you have to do: take a tablespoon of sesame oil in your palms. Gently massage it into the aching area of your body. Leave it on for 10 minutes. Apply a hot compress over it. Leave it on for another 10 minutes and remove. You can also consume a tablespoon of roasted sesame seeds daily. How often you should do this? Massage with sesame oil 3 to 4 times daily. Why this works: sesame seeds are an amazing remedy to alleviate symptoms of pain when applied topically, in the form of oil, and also when ingested. 6. Ginger. You will need 1 teaspoon of grated ginger, 1 cup of water. What you have to do: add a teaspoon of grated ginger to a cup of water. Bring it to a boil in a saucepan. Simmer for 5 to 7 minutes and strain. Allow the ginger tea to cool a bit before drinking it. You can also soak a washcloth in the ginger solution and apply it to your neck and shoulders. How often you should do this? Drink ginger tea 2 to 3 times daily for optimum benefits. Why this works: the pungent compound in ginger is called gingerol. This compound exhibits anti-inflammatory and analgesic activities that can help in relieving the symptoms of cervical spondylosis. 7. Castor oil. You will need 1 tablespoon of castor oil, a warm compress. What you have to do: take a tablespoon of cold-pressed castor oil and gently massage it onto your neck and shoulders. Place a warm compress on top and leave it on for about 20 minutes. Remove the compress and rinse off the oil. How often you should do this? You can do this twice daily. Why this works? Castor oil contains ricinoleic acid that helps in relieving the pain and inflammation that accompany cervical spondylosis.